Tom, I could ask if there's any differential effects of the chemicals you're studying on different stages of development. We think of the developmental phase of the embryo, then the fetal life and neonatal life and infancy. All of these have different levels of expression of thyroid hormone receptors and then downstream effects of that signaling pathway. So I wonder if you've been able to address these different stages, not just that there might be an impact.
Right. That's actually a difficult thing to do because these chemicals are often, they have a long both serum half-life, but half-life in the body. So if you begin early with some kind of exposure, you really don't, it's going to be very difficult to determine exactly when the hit was, in quotes. I think that it's an important issue for sure. What we've looked at both fetal and kind of perinatal development. The effects that you see at any one time are kind of multivariate. So in the same tissue, in the brain, for example, you can see evidence for that these chemicals, PCBs, can act like thyroid hormone agonists, antagonists, or be neutral. So it's going to be very complicated for sure.
Thought that was an extraordinary presentation. As a humble clinical neonatologist, so pleased that we had put TSH assessment on samples of children. What do you think the impact of this would have on our trying to evaluate the TSH screening programs that are currently in place?
Right. I think that, first of all, you have to look in epidemiological studies, and I'm not an epidemiologist, so I'll just pretend to be one for a second. But from my point of view, I think it depends on the chemicals that you look at and how they may be working. For a chemical like perchlorate that inhibits iodide uptake, I suspect that looking at TSH is a good way to do it. I think that all the evidence suggests that a T4 decrement in relation to perchlorate exposure is also kind of matched with a TSH increase. But with other chemicals like polybrominated diphenyl ethers and perhaps PCBs, it's not as clear. And so the data, I think, are going to be much more difficult to interpret. In a perfect world, it'd be great to have T4 and TSH both, but and that is, if you look at Europe and the US, there's different thoughts about which is more important. You're going to miss some things.
Hi, yes, this is Abby Fleisch from Boston Children's Hospital. I was just wondering, you showed at the beginning of your talk the structural similarity between T4 and then the PCBs and PDEs. How exactly do you hypothesize that, based on that structural similarity, exposure leads to low T4 and then no change in TSH?
Well, so I think it's reasonable to think that these chemicals are activating enzymes in the liver that increase T4 clearance, and we've pretty much shown that certainly for T4. The reason that TSH doesn't go up, I don't know that. I think there's, I guess my favorite theory is that these chemicals also increase kind of an inflammatory response and could produce a situation that's maybe similar to sick euthyroid syndrome. But other than that, I'm not really sure. I don't think that these chemicals are acting to suppress TSH directly. We've looked in TSH in thyrotropes in culture, and we don't really see that. So I think it's something systematic.
Thanks.
My name is George Rogers from the University of Louisville. I'm going to stick my neck out. And this is an area that I've been following as a medical toxicologist for many years. And it's fascinating, and I really enjoyed your talk. But I get very frustrated by it because we actually live in a chemical cesspool, if you want to look at it that way. You're looking at individual compounds. In fact, if your data, the one data point you referenced, where in cord blood you can find over 100 different chemicals in every cord blood sample you look at. Nobody's looking in any detail at mixtures. How do you see, looking ahead 10, 20, 30 years, that the data we collect in this area is going to be useful to us in either managing patients or preventing some of the potential damage? If you see the gist of where I'm going with this.
Absolutely, it's a great question. I think you're probably not the only one frustrated with that concept. I also think when there are some mixture studies that have been done, I think Andreas Kortenkamp is probably one of the best who has looked at that. But even in his work, he's looking at how chemicals can have a cumulative effect on a single endpoint. That's very, the thyroid system, I think, is ripe for this situation where a chemical might increase liver metabolism, but at the same time may affect the receptor, may affect deiodinase or intracellular uptake. These kind of mixtures that have different kinds of actions on the same endocrine system, that's a difficult thing. Nobody has any idea. We don't have the pharmaceutical cornucopia that reproductive endocrinologists have. And so it's a complicated issue. I hope in 10 to 20 years we do have better information about that, but I also think that reducing exposure and being clever about how we reduce those exposures are going to be important.
Thank you, Tom. Thank you.
Thank you, Tom.
Talk about the timing of puberty, pubertal development, particularly breast development, and breast cancer.
Certainly. So that we know from several studies that age of menarche in epidemiologic studies have been used sort of as a milestone and as a variable, an important marker of breast cancer. If I ask the women in the audience your age of menarche, you'll give it to me within 85% of you. Well, since this is a group of physicians, 95% of you will be able to tell me within 6 months what your age of menarche is. The other who can't say it are the guys in the audience. Thank you. I'm glad you're listening. But if I asked you when your age of peak height velocity was, you would be hard-pressed to be able to tell me when that was. And that biologically, that is a much more relevant factor. And the reason it's a relevant factor may have to do with one of the pro-growth hormones, IGF-1. Girls who go into puberty earlier have higher levels of IGF-1. Girls who go into puberty earlier have a higher peak height velocity. Girls with a higher peak height velocity also happen to have a higher level of IGF-1. And women with high IGF-1 levels have a higher breast density and higher rates of breast cancer. So the age of menarche is a good substitute variable, but probably the biologic mechanism is growth and growth factors. And that probably is the relationship between menarche and onset of breast development.
Frank, that's a really nice talk. Kimberly Gray from NIHS. So this peak height velocity, were you able to pick it up a little bit better than the others since you were assessing it every 6 months? It can't be done if, with Brenda's every 3 to 6 year follow-up. Are we going to be missing some critical time windows?
Okay, so almost all the time we want to try to get annualized height velocity. The question was about measuring height velocity and the frequency of height velocity. If you want to capture the age of peak height velocity, you can do it a little bit more precisely if you measure it every 6 months. But we used to analyze whatever we did with the intervals. We always annualized it to 12 months. There are some statistical modeling packages that if you capture 3 to 4 heights just before, during, and immediately after puberty, that you can place them into these models and they'll give you estimates of age of peak height velocity and peak height velocity. So there are certain models that will allow that. But one of the reasons I did every 6 months actually was to try to more precisely define age of peak height velocity, because that was one of my hypotheses, that that was probably the measure and it was not age of menarche. Age of menarche, again, biologically, why would, again, you influence 9% risk of breast cancer difference in just 1 year of menarche if you're changing, if it's supposed to be estrogen related, then you're changing a woman's reproductive life course by 1 out of 35 or 40 years. That should be a 2% risk. That shouldn't be a 9% risk. And so I felt that it had to be another biological parameter associated with puberty.
So Kim, I was intrigued by this idea of looking at postpartum women
Yes.
and the concept of whether environment exposures may have an impact on the ability of women to return to their pre-pregnant weights, and whether that's a topic that's of interest or
It
actually
is.
been studied.
It has not. It has been in another field. So we saw a lot with gestational diabetes and weight gain during pregnancy, and it just hit us when we've been working really hard with NIDDK through the environmental determinants of diabetes in youth, that there's this opportunity for us to really look at the role of environment, not only the health on the children, but really the health on the mom, and that's where we hope that a lot of our investigators have that data and maybe haven't looked at it, but we hope to offer some opportunities for them in the future.
Yes.
Yunt, old guy from Oregon. Old bald guy from Oregon. I was interested in knowing if you had any ongoing assessment of artificial sweeteners as self-inflicted toxic materials.
So not in our research portfolio where we give money out to extramural, but we do have that within the NTP program. So the National Toxicology Program is doing a lot of screening, and I think they just wrote a monograph not too long ago. But it is possible anyone can actually nominate chemicals to be looked at, and ToxCast has an incredibly broad screening tool now. They've got some money from NCS funds to expand that. So if it's something that they haven't covered, we really open that, especially to our pediatric community, to nominate any chemicals that they feel that maybe we've missed analysis. But as opposed to that kind of grant would not be assigned to NIEHS. If it came extramurally, it would go to NICHD. But in-house, NTP can look at those.
Thank you very much.
Thanks.
Thank you.
The man from
Hi.
Oregon.
Hi, old bald doc from Oregon again. I spent 4 years in the valley south of that as a neonatologist on the edge of the referral system, and observed 10,000 births in that particular valley as one of the 2 neonatal people, and also the families. And I'm struck by 2 things that I think you might need to be careful about. These are poor people, but these are highly loving, integrated, supportive families. The mothers have all of the kids all dressed up beautifully, taking the kid to school, all the way through the whole community. Mm-hmm. And I would think that it might be important to know what the IQ of the mothers were at the beginning of the study, because I'm thinking that perhaps the lower IQ moms are going to be more likely to be out in the field getting exposed, and the higher IQ moms may not have quite as much exposure.
So we are a community-based participatory research project. We work very closely with the community. We measured mothers' IQ at 6 months, when the children were 6 months old. So all of the results I showed you control for that, just so you know that. And you're absolutely right. It's why I love this community. The mothers really, they're a different kind of helicopter moms, and the children always show up clean and beautiful, even if they have no money and they have no food.
Yeah, and I don't think they're headed toward jail. That's the other thing.
I'm not sure about that. I'm really not sure about that, because Salinas Valley also has the most jails and prisons in the state of California, And we already know, unfortunately, I already know too many of our kids that are in gangs. I haven't reported on that yet. We also know a few of our kids out of 600 that are on meth. And it's actually very sad for us because we know these families very well. But we are seeing already kids that are headed for trouble.
The other thing is your females are now right at the brink of what has been traditionally the time in which they start to have their families. Their late teenage, I mean, massive amount, unfortunately large number of late teenage women having pregnancies in this group.
So one of the things that we have not seen any pregnancies yet, but what we have learned from other studies is that that actually sexual debut is a little bit later in low-income Latinos, but it's higher risk. So that they're less likely to protect themselves. So we haven't yet seen, I mean, the kids just finished their 14th. We just got the first child turned 16. We're expecting that things are going to be big time right now. That's why we need to follow these kids in this critical juncture.
Thank you. Paul?
Hi. Brenda, thank you very much for this great overview of this astounding study. And it was your work that inspired us to ask the same questions that you asked of the entire California population using the peer data. And what's striking to us is that we used, the epidemiological exposure data that really pales in comparison to measuring the pregnant women and having a pixelated locations and times for pregnancy, but ranked all the counties in California by pure data to low, medium, and high pesticides and types. And we really found all the same things you found for the entire state. That is, when just gross pesticides or any subset of pesticides is used as a ranking of the mother's county, shorter pregnancies are occurring in the high pesticide counties, and they're the shortest in the highest pesticide months. And I would suggest to you as a neonatologist, we're now learning that every week of gestation that is less than 40 weeks is a drop in IQ. So some pesticides don't have to be neurotoxins to lower your IQ. And this is a very important concept that we've now come to understand in fetal origins. But perhaps you might want to comment on that. We also used, of course, all the pesticides together rather than just organophosphates. And the final point is, as you now know, the epigenetic consequences of exposure, I'm not sure they even have to be endocrine. I think if we can be epigenetic disruptors, that probably is sufficient to produce third generation disease. For instance, 50% of third generation offspring of rodents exposed to DDT are obese. So we're not, we tend to be very focused in our preliminary epidemiological studies to look at organophosphates as neurotoxins, but I think it's way bigger than that. And of course, what you found in Salinas Valley in Latina women turns out to be relevant to all the women in California.
I think I'll take your last point first, which is we actually looked at the distribution of DAPs in our cohort, not what I showed you, but the actual bell-shaped curve. And it's amazing how similar it is. It's higher shifted, but it's very similar in terms of range to the general U.S. population. Mm-hmm. So you're right. I think what we're finding is relevant to the whole U.S. One thing I wanted to mention is that because we were concerned about having found a relationship with gestational duration, the same one that you mentioned, we controlled for gestational duration when we looked at IQ because we wanted to be sure we were seeing something that was different than. So these are really two things independent of each other that we're observing.
Bad news, but excellent.
Thank you.
You did that. Thank you.
Yes.
Hi, Cynthia Baer, University of Maryland. I have a quick question and then an advertisement. The quick question is, When DAPs aren't a really good marker for exposure, and you've gone to the air data, but it still would be nice if there was an internal dose. Is anybody looking at biomarker discovery to try to look at early biological effects of the exposure to get a better handle on the exposure?
So Cynthia, give me some ideas of, I mean, we're beginning to look at epigenetics now. So we have measured, but I'm not sure that's what you're talking about. You're talking about something else, right?
I think I would almost think about proteomics or some way that you can change that cell metabolism has differed. And I don't know what the current state of that field is.
No, not that I know of. I mean, we would like to look at metabolomics, but we haven't done so yet.
Okay.
We have the specimens. Nina's looking at metabolomics in relationship to the phthalates, but not in relationship to the OPs.
Yeah, that's interesting. It's an
That was the grant that didn't get funded.
And then the comment was, I noticed on you've published great stuff on this, but all of it is in like EHP, and P doesn't stand for pediatrics, it stands for perspectives. And I'd really like to see it more in the sort of mainstream pediatric journals. And so I'm now I'm the new editor of pediatric research, and we've set up a new section just for pediatric environmental health. With our section editor is Debbie Koreslekta, who I know that you know. So I would invite you. I saw the submitted ones. If they get rejected, send them to us. And I invite anybody in this room who's got research articles on pediatric and environmental health to send them to pediatric research. So thank you.
Thank you for that, because as you know, most of the mainstream pediatric journals haven't been very gung-ho about environmental issues. Okay, I'll come your way.
One last question.
Youngjoon, Mayo Clinic in Rochester, Minnesota. I am actually a general pediatrician. I'm a clinical epidemiologist. So we're running into this environmental issue, and my question is really sort of a methodological issue. So you mentioned it briefly, and then it's sort of like looking at impact of not a single chemical compound, more so mixtures. But when you really analyzing, looking into this issue, really coming into here, one is really multiple exposures at the same time. Level of exposures are going to be one thing. Another one is in the duration of exposures. Another one. Then lastly is going to be really window of susceptibility. You're taking into account the whole factors is really critically important in terms of what kind of intervention needs to be happen at what point in time and how. But to me is right now, statistical modeling and the analytic method is so infancy, is so limited. And really, in my opinion, with generating data, proteomics and genomics and microbiomes, just amazing data. We just bottleneck phenomenon. How we going to analyze the data? We're just going to really, a lot of time ended up is a p-value is really not meaningful. There are a lot of time, perhaps, journal publishing p-value, we just ended up. It's not just reproducible p-values and the findings. I think that this is going to be real challenges, and then at a point in time, we ended up so many inconsistent results, and just to back down the people just don't look at any more scientific data. This is the way public sway by activists very charged with a very not evidence founded the data in this. This is a real phenomenon in a methodological standpoint.
I think your comment is the perfect comment to end the meeting at, except that it's a little depressing. But it's very true. And although we've done a feeble attempt of controlling for other exposures like PBDEs and DDT in this population in relationship, when we're looking at IQ and other endpoints, it's feeble. And we're trying better statistical models, but it's still feeble, in my opinion. And I think that, hopefully with the new ECHO consortium, we'll have the sample sizes, provided everybody analyzes everything the same way and the cohorts are similar enough. But it's still going to be a very difficult challenge, because I think what you said is really why we need to be involved in prevention rather than observation.
So
So thank you very much for your participation and to all of our speakers. So Bill and I are actually very pleased by the outcome of this because I think it was a very interactive, very educational session. Thank you.
Thanks, everybody.